of the theme.
Yeah, and this interview segment, I want to talk a little bit about early trauma and its effects on children. Yeah, because I realized that you have a new book coming out soon. Not in English yet, but it is already out in German.
It's out in German, it's out in Dutch, it's now out in
Norwegian. Yeah, and it's entitled Early Trauma. So can you give us a preview here on the types of early trauma that there may be, and how it actually affects children, mothers first, and then children?
Mm-hmm. Yeah. This idea that go further back in the biography of our clients, it came when I realized how traumatizing the birth process can be. And so looking closer to this ways that how birth is giving, then you can see this can produce situations where the child is in risk to die, or even the mother is in risk to die. And then you have one type of the early trauma, this all around the birth process. And also when the child stuck in the birth channel, or to pull the child out of the vacuum or forceps, so that is traumatizing. It's a traumatizing experience for the child, also for the mother, because this is too much to feel. And what's also a traumatizing way of giving birth is the cesarean sections. Even normally they are looked at as if they are normal. It's just a normal procedure. But when we work with clients with this experience of having been pulled out of the mother's womb by cesarean section, we also find that it was traumatizing.
Even for cesarean, when there is no pain for the mother?
This is the problem, that there is no pain. Because the pain in the birth process also is the basis for that all the other hormones are produced. The dopamine, oxytocin are produced, and if there is no pain, if there is no feeling, all these hormones that are necessary for the bonding process out of the womb, they are not there. So then when the child is taken out, and maybe you show it the mother, that no bonding can take place. This is the link, the bonding. That bonding is something that has to do with the body. And if mother's body is numb, and the child comes out, and maybe he's in a way also numb in a way by this procedure of being pulled out, how the bonding can happen.
There's no conscious bonding at all.
There's no body bonding. There's no body bonding. And there are so many things they have done, even if there is a so-called natural birth process, that the medical system does a lot of things to interrupt the bonding process that is so important of the birth.
Like for example?
Body contact. Smell contact, the contact with all your senses. The child now knows the mother from inside. And now the next step is to learn to know how the mother is from outside. The bonding, and the same for the mother. The mother for the first time sees the child, and it needs a lot of preparedness from the body that you get by some hormones too. This preparedness to really take the child on. That's your child, and the child takes you on. Oh, that's my mother, and this is it's a safe contact. It's a loving contact, and so in this clinical way, in the way when the birth is given in the clinics, there are so many procedures that interrupt or make it impossible for the child and the mother to bond.
The first moments of bonding.
The first bonding, the first hour. That is so important that they are left alone on themselves, and nobody intervenes. So we have after birth have this very sensitive period that the bonding process should take place, and if it's not possible, it's interrupted, then we have again one more element of this, what causes a trauma of love. That this love relationship between mother and child is not really made by the body contact. The whole
So even if the father were to be there to bond after the cesarean, there is
the child is
mother.
confused. The child is confused. The child has, in a way, has to split off, to give up the desire of wanting the mother, because everything is prepared with the child. Then come out and have the contact with the mother. Now, what is taking place? First is to have contact with the rubber gloves of a doctor.
That's right.
Yeah.
Yes.
And then a nurse comes. And then maybe some person comes, maybe you never have seen before yet, or heard before, the father. When not every father is so close in contact with the pregnant wife. So then the child, who is that? And then of course they try to bond. And then afterwards they have the difficulties. Who is the most important person for me? And it loses the orientation and produces so much confusion inside of so little child. And these children are so aware and so open, and they take in what's coming, and they have so much confusing information.
So what could be some of the possible consequences? The consequence for the children after they are born this way, and when they grow up, what are some of the possible consequences that they may be getting into through your experience? Is there any?
For developing a healthy eye, you need a healthy other eye.
Okay.
And if in your environment you have around yourself so many confused persons, so many stressed persons, so many persons that are focused on fears instead of love, then of course you think this is normal, and fear is normal, and love is normal. And this goes on the next generation, with the stress of the first generation is going to the next generation, and it seems that if this is normal. And in the end, the whole society thinks that we produce stress during the birth process, and we perceive it normal.
So it's not normal.
No.
Okay, so are you saying that mothers who have mothers who have been through complicated births themselves would also give birth, will also have difficult, complicated births?
Yes, that's what we can observe. If the mothers do have problems with their body, especially maybe this type of the body where the child is conceived, maybe as a consequence of sexual abuse or being beaten, then the mother dissociates from the body, and then if she's not able to give the child the contact the child is needing.
Right.
And so it's frozen, and some clients, if they do the regression in the mother's womb, they feel that it is cold inside.
Right.
It's like a frozen area. And so out of this, then you have all this complication through pregnancy. You have the complication when it comes to birth. You are as a woman, you are a mother. You are not in contact, in communication with the child when it's the best stage that the child comes out and so on. And so the mother does her own thing, and then the child is left alone and has to do his own thing. And then we have all this many birth complications, and then the medical staff comes, tries to do something, but very often he
just adds on to
the stress, adds on to some that the communication does not work on the communication, but now you trust on medical pills, and it makes it even complicated, and then in the end everything becomes more and more dangerous, and then you have to say, oh no, the only way to get the child out is the cesarean.
Right. Okay. So therefore, because of this bonding that is affected, it starts all the many other consequences when the child grows up.
Yes.
So for mothers who are aware that when they are expecting their babies, they are already emotional. So maybe now, a mother comes and they are aware that, when they are expecting their children, they were emotional, and they were, really not in a very happy mode, and maybe they may have thoughts of not wanting the baby. So if the harm has already been done, now that the child is born, what can they do?
Do you think During pregnancy or after?
After.
Because it could also be very interesting that women, when they are pregnant and expecting a baby, that they do in this time.
Really?
They do work on themselves.
Will it affect the baby because they will be feeling their emotions and all? Will it affect their baby?
They are involved in the mother's trauma. So if the mother does work on herself and tries to integrate more, then it's the best that they can have, even during pregnancy.
So when the mother goes into emotions in the therapy, it will not affect the child.
If these are healing emotions, it will affect the child in a good way.
Okay. So there are healing emotions and
there are
not the non-healing.
There are emotions that cause you to split. And this is what, if you work with a pregnant woman, of course you have to consider to bring them in.
This is so exciting. Wow. So every expectant mother should understand about this.
Yes. It makes it easier for her. The whole pregnancy and the whole birth process becomes much more easy the more she works on healing emotions, and also it's a huge benefit for the child.
So can you explain a little bit about how miscarriages and abortion affect the mothers, and then eventually the children who survive after the previous children were, or maybe their younger siblings?
So, if you do an abortion, or the woman do an abortion, it always affects you because the whole body is in a way prepared for the pregnancy, and then if you interrupt this, then you split yourself. And then the question is how you can integrate again. And this is something if you have done an abortion, it's very helpful, really to work on it, therapeutic work on it, trauma work on it to overcome this. Because if you have done an abortion and then come pregnant and then you get the child, then the child is conceived into a traumatized uterus, and though it affects the abortion that has been done affects the pregnancy and affects the child and affects the relationship with the child. So it's very important when a woman has done an abortion before she gets pregnant again, she should have done trauma work. And the same with miscarriages or stillborn babies. Before you get pregnant again, when it is possible, do before the trauma work.
Before getting pregnant.
Then you are free to conceive and make the bonding to another child.
Right. So how do you know, say a mother comes and after she had possibly an abortion miscarriage, how would she know that she's ready to conceive again?
You see
how many?
You see it in the work. You see it in the work. If you say, I want to work on my abortion and I want to have a child, you see it. It is okay. You can't betray yourself by this consummation of the sentence of intention.
Yes.
It's not possible to.
So amazing.
Yeah.
So like what you said, the early trauma can be passed on from one generation to another. So mothers in every generation experiencing almost similar symptoms. So we can stop it here in this generation, isn't it?
Yeah. And this is also that when a woman gets her own children, then the body remembers how it was for her when she was conceived, when she was in the womb. So it all comes up because it's so emotional, this situation, that all this what is still in the body of the mother comes up when she herself becomes a mother. So it's so good for her.
Yeah, it's very important.
To have her to use this situation and then clear it for herself. And what I did not mention before, the question before, is to survive an abortion for the children if there is an attempted abortion and the children survives. This is now we have many cases that we can say this is one of the biggest trauma.
Biggest trauma.
One of the biggest trauma with a huge.
Why is that so?
A huge impact on the whole
life.
Because so early you have to survive, so early you have to split off, so early you have to go into with the whole body. You have to go in a surviving state. And maybe you have to squeeze yourself together in order to not to be hidden by the needle or whatever comes in. So this stays in the body. This surviving strategy is
the physiological state.
The physiological state in the whole body.
Okay.
And then you have this separation between this is the body state and this other thing is your mind and your psyche, and to bring it together again. Then it's necessary to go back to this starting point. Otherwise, you are split off from your body all your life.
So, is it the same effects if the mother has just thoughts of abortion, just thinking about aborting, and not actually doing it yet? But the thoughts be as equally harmful as well, like, I'm not ready for the baby and
it's not equally harmful.
Okay.
The mother, when she's thinking about that and she's in a
emotional state,
troublesome relationship with her partner, then this of course gives stress to her, and then the stress is passed on to the child. But it's of course it's a big difference if you think, or if you do it really directly using poison or using needle. It's for the child. It makes a huge difference.
Use poison? Do they still use poison now in this generation?
If you give some injections, they kill these chemicals. It's poisonous for the child.
So, say the mother has already done it, like tried to abort, and what can they do? Should the child come for therapy as well, or the mother come alone first, or
if the child is still young?
Yeah, still young.
First,
maybe less than
always
10.
first.
The
mother, they become more aware what the consequences are, and they do something to improve the relationship with the child. So it's always the best that the mothers do something, because then for them it's easier to deal with the child. Otherwise, it's a constant struggle with the child.
So, is there any word of advice to those who have not given birth yet?
Yes, it's the same.
Those who are.
If you want to have children, as a woman or as a man, it would be very good.
Men as well.
It would be very good first of all. Look, if they are traumatizing experiences from your past.
During their birth time, is it?
Yeah, during whole life.
Oh, okay.
That you are able then to be a mother or a father and you enjoy having children. Otherwise, if this is not the case, why do we have children? If it's constant trouble and constant arguing, constant fighting, and constant constant misunderstanding.
So, I guess the consciousness of a mother and parents, especially before they have their children, is really very important, because it has shown up in so many processes that parents have children for so many different reasons other than just really wanting to have a child. Most of them are used, for different reasons and to serve different purposes of the parents or the marriage. So, what can they do to become aware? Like, is it something they can think about first before they have children? Do you have any advice to give to parents to be?
Yeah, the one thing that we have written this book, and
okay.
how it comes out in different languages.
Please go and buy it.
How it comes out also in different languages. That you can have the information. It's really important that we get more informed about what is all these basic processes, what happens there and how important they are for their whole life. And so just to get more awareness, more information. And then the next step would be to talk, if you want to go further, make counseling, and then if next step go further and make some therapy and use what we have developed as method and getting more care.
Okay, so thank you, Franz. Thank you. And of course, Franz has got a lot of information and a lot of resources, even in his book. And I really want to encourage all of you to grab a copy. Early Trauma has yet to come out. There are many of his books that has already been published. So do order a copy. It's available online, and really get immersed into his wisdom of and understanding into trauma and how can trauma affect us. So to the next video. See you again.